Today's exercises are for pelvic girdle pain in pregnancy. They are also great for low back pain and other pains around the pelvic area, whether you're pregnant or not. We are going to start on all fours, and we're going to start with some deep breathing exercises, the hug your baby technique, and including a pelvic tilt, so breathing in, belly out, breathing out, belly in, drawing your belly button in and hugging your baby, tilting your pelvis as if you're trying to draw your pubic bone towards your belly button. I'm also going to show options with the ball, which sometimes might be relieving in pelvic girdle pain conditions. Now we're going to sway forward and back while maintaining the pelvic tilt and pelvic floor engagement. Repeat the same thing, but now sideways, rock from one side to the other. Very good. Find the center position, deep breath again, engage the core, engage the pelvic floor and hover off your knees. Hold for a few seconds while maintaining core engagement and release down. Again. Again, you can try this with the ball. Sometimes it can be easier. Sometimes others might find it a bit more challenging. Very good. Now we're going to go back into child pose. So open the knees wide apart and walk your hands forward. Try to push your chest close to the floor and your hips close to the heels. If you want to deepen the stretch, you can go up on the tips of your finger. And if your belly feels a bit too big to stay in this position, you can always go on your elbow. Now we're going to go on our buttocks, on our heels. Start with pelvic tilts, then we're going to go up and down by raising the hips. Tighten the glutes to go up and down. You can do it with or without the hands, with or without the ball. It's important that you use your buttocks muscles and not your knees to go up. And breathe while doing them. Breathe out, going up. Breathe in, going down. Keep going. Now we're going to go into standing. We're going to keep the feet hip width apart, bend the knees slightly, and start by doing some pelvic tilting and engaging the pelvic floor. We're going to do 4 mini squats. Keep the core and pelvic floor constantly engaged. And then we're going to stay down into a squat and raise the heels 10 times. Keep the core engaged. Next, we're going to alternate one heel and then the other for 20 times, so 10 times on each side. Next pose will be the chair pose. Again, find the correct pelvic position by engaging the core, drawing your belly button in and engaging the pelvic floor muscles. Hold for 10 seconds in total. And now we're going to extend one arm backwards. Hold it for about 4 counts and repeat 5 times. Then we're going to repeat and do another 5 fast. And let's go with the fast ones. Five. Now do another 5 with a heel raise, just one heel raise. 1, 2, 3, 4, 5. And let's repeat on the other side. So we're going to start in a chair pose position. We're going to extend the other arm backwards, hold it for about 4 counts, and repeat 5 times. After this, we're going to do 5 more fast, and then another 5 with a heel raise. And fast. 2, 3, 4, 5, and with the heel raise. 1, 2, 3, 4, 5. Now stay in that position and switch from one arm to the other, doing the same thing, lifting one heel at a time. 10 times in total. Keep engaging the core. Belly button in, pelvic floor engaged. Very good.